So here we are going to talk about antiarrhythmic medication. So antiarrhythmic medication we use to suppress the dysarrhythmias by inhibiting the abnormal pathway of electrical conduction through the heart. So if our patient have dysarrhythmia, we need to correct the dysarrhythmias. And that times we use anti-arrhythmic medication. So anti-arrhythmics drugs or medication particularly correct the abnormal rhythm. And also antiarrhythmic agents, sometimes it is known as cardiac dysarrhythmic medication. And these are a group of pharmaceutical agents that are used to suppress the abnormal rhythm of the heart, like atrial fibrillation, atrial flutter, ventricular tachycardia, or ventricular fibrillation. So all are abnormal rhythm. So antiarrhythmic drugs we categorized into the 4 groups, like class 1 antiarrhythmics are called sodium channel blocker because these drugs work on the sodium channel and they blocks it, like procainamide. Class 2 are called beta blocker. We like most common use are propranolol. Class 3 are potassium channel blocker. This medication that delay the repolarization. Most common use are amiodarone. And class 4 are called calcium channel blocker because these groups of drugs block the calcium channel. Most common are use of verapamil or diltiazem. Let me explain every class more details. The class 1 again subdivided into class 1A, class 1B, and class 1C. Class 1A antiarrhythmics most commonly used are procainamide or quinidine sulfate. And class 1B antiarrhythmics are lidocaine. And class 1C antiarrhythmics most commonly we use flecainide or propafenone. So if you ask me, what are the indication of class 1 antiarrhythmics drugs? We use these groups of drugs because of supraventricular tachycardia or ventricular tachycardia. We use for atrial flutter or atrial fibrillation. The common side effect or adverse effect of class 1 antiarrhythmics are they can cause hypotension, heart failure, worsening or new dysarrhythmias, or they can cause nausea, vomiting, and diarrhea. So the class 1 we call sodium channel blocker. So what are the mechanism of action of class 1 antiarrhythmic medication? We can call sodium channel blockers. They block the sodium channel. And most common side effect, hypotension, or some books said lupus-like symptom or leukopenia, even they causes the thrombocytopenias. The second class, it is called class 2 antiarrhythmics. Most common drugs are propranolol. Other drugs are acebutolol, metoprolol, nadolol, or atenolol. Right? And these groups are called beta blockers. They block the, or mechanism action is the non-selective beta blockers, particularly propranolol. Side and adverse effect of class 2 antiarrhythmics, they can cause dizziness, fatigue, hypotension, bradycardia, heart failure, dysrhythmias, heart blocks, or bronchospasm, also gastrointestinal distress. So most common sign of adverse effect are they can cause hypotension and bradycardia. Also fatigue or weakness. The key point for NCLEX board, these groups of drugs can cause bronchospasm, so do not use in patient with bronchial asthma. Class 3 antiarrhythmic drugs, it is called calcium channel blocker. Most common medication are amiodarone or sotalol. So the indication of class 2 medication we use for ventricular tachycardia or ventricular fibrillation or atrial fibrillation. Class 2 also we use for supraventricular tachycardia, atrial flutter, or atrial fibrillation. And the next here, the common and adverse effect of class 3 anti-dysrhythmias, they can cause hypotension, bradycardia, as like as class 2, and GI upset like nausea and vomiting. Amiodarone may cause pulmonary fibrosis. The NCLEX board asks question from here. So pulmonary toxicity, or they can cause liver toxicity. They also cause visual disturbance and thyroid dysfunction. Very important for NCLEX board. So class 3, amiodarone can cause photosensitivity, blue skin discoloration, corneal deposit, peripheral neuropathy, tremor, poor coordination, and abnormal gait and hypothyroidism. The electrocardiogram should be monitored for the client who receiving amiodarone because they may prolong QT intervals and potentially lead to torsades de pointe. Is another abnormal EKG findings. And class 4, it is calcium channel blocker. So particularly verapamil and diltiazem. The common indication of class 4, we use supraventricular tachycardia, atrial fibrillation, and atrial flutter. The most common side effect, they can cause hypotension or bradycardia. Keep it note, verapamil or diltiazem we also use for hypertension, or we can use for angina, not only the antiarrhythmics drugs. They are antihypertensive and anti-anginal medication as well. The mechanism of action of class 4, they work on the calcium channel blockers. They work on calcium channel and block the calcium channel. So we call calcium channel blocker. The common side effect, they can cause hypotension, bradycardia, and GI upset. Here, right, dizziness, edema, and constipation. Other antiarrhythmics we use, we call adenosine and digoxin. So what are the intervention for antiarrhythmics? So if our patient take the antiarrhythmics, we have to monitor the heart rate, respiratory rate, and BP, monitor EKG, electrocardiograph, means electrical events represent in the graphical presentation, provide continuous cardiac monitoring, or maintain therapeutic serum medication levels. Before administering lidocaine, always we have to always check the vital level to preventing administering a form that contain epinephrine or preservatives, because this solution are used for local anesthetics only. Do not admit antiarrhythmic with food, because food may affect the absorption. And also antiarrhythmic administration with food, only one drugs, or antacid to reduce the gastrointestinal upset. Always admin IV antiarrhythmics via infusion pump. Very important for NCLEX board. And now next here, monitor for the sign of fluid retention, such as weight gain, peripheral edema, or shortness of breath. Advise the client to limit the fluid and salt intake to maintain the fluid retention. Also monitor the respiratory, thyroid, and neurological function. Instruct the client to change position slowly to maintain orthostatic hypotension. Instruct the client taking amiodarone to use a sun protect cream or protective cloth to prevent photosensitivities, because amiodarone can cause photophobia or photosensitivities. Also encouraging the client to intake fiber intake to prevent constipation, particularly calcium channel blocker.